right, welcome everyone. Good morning. And we are now going to do an update on the Psychiatry Certification Exam. And this is all stuff, most of the stuff I'm presenting is on the ABPN website, but sometimes it's hard to get to it and not everyone knows about it. So I think it's a good review here. And then I will add a little bit of some tips on how to handle different kind of questions. Remember to bring 2 forms of valid ID. One has to have a picture ID, like your driver's license or passport. Now, you can take things with you as you go into that building, wherever the learning center is, personal learning center. But then you cannot take anything into the testing room. And they do give you little lockers you can put in your purse, your wallet, anything else you have with you. Maybe you're bringing lunch or something like that, so you could put it all in there. And then they just give you a key that you return at the end. They palm print you every time when you come in, and then every time, like if you use the restroom or take a break, each time they palm print you. You are continually observed during your testing in the testing room, so just be aware of that. Be aware also that not everyone around you is taking a psychiatry certification exam. These learning centers, they work with all different kind of companies and organizations, that require like a secured testing environment. The ABPN tells you cannot leave the building. Now, given the fact that you may be spending up to 9.5 hours there, that kind of suggests you should make sure you bring food and drink. I mean, there are water fountains, I'm sure, in the building, but I wouldn't count on anything else necessarily. And now, medication names, it's a frequent question. So each question on the exam uses generic medication names. And I know that we're not all equally familiar with the generic names, but there are brand names available that you can take a look at. There's a tab from the bottom left corner of the screen where the generic and brand names are cross-referenced. The exam breakdown is as follows. As you I'm sure well know, the total exam duration is 9.5 hours. The exam time, though, the time that you're answering questions, is 8 hours and 20 minutes, which is 500 minutes. You have 5 minutes before the exam starts and then 5 minutes afterwards. At first you have to sign a disclaimer form, and then afterwards you can fill out like a kind of a survey or give them feedback. So in addition to all of that, you have 60 minutes of full pooled break time. So that means there isn't like any particular lunch break. You don't have to take a lunch break. You can divide up this time any way you like. You could take less time. That does not gain you any test time, however, as you know. Now you can also take more time than 60 minutes, but anything over 60 minutes cuts into your exam testing time. So you're cutting into your 500 minutes of total test time. And again, the breaks are optional, and there are going to be 8 sections. So you're going to take a break between sections. And, you can pace yourself. It's going to be very individual. You might say like, I did one of these sections, one of the 8, and I feel good. I'm just going to keep going. Maybe I do 2, maybe I do 3. Maybe then I take a 10-minute break or a 20-minute break or a 30-minute break, whatever. Some people will just kind of evenly divide them up. Other people will kind of, again, because you're fresh in the morning, usually you just kind of, let's say, go through half the exam and kind of then start taking break times in the afternoon. There are also people who don't take any break time. They just want to get the heck out of there ASAP. Again, in the 500 minutes that you have, you're to answer 425 questions. So that's approximately 70 seconds per question, over a minute. That should be sufficient time. Again, very important. I highly, highly encourage you to do practice tests ahead of time. Not just practice questions. This is not, doing practice questions is a good learning method, but there's a whole another reason to do it, is to assess your pace. And for most people, their pace is just completely fine. And then if you test your pace and you're like, oh, okay, I spent 60 minutes and I answered, 70 questions, 60 questions, 70, 80, whatever. You're like, okay, I'm at a pace of a minute a question or even less than a minute, and I have 70 seconds a question, so I'm okay. Now, there are going to be some of you who actually, your pace is too slow, so it's very good to know that ahead of time, ASAP, today rather than tomorrow, and then figure out what's causing you to slow down. Oftentimes it's really, if you're running out of time, it's because you have to review how what's interfering with your ability to answer questions. You can be what I call frozen in indecision. You either know the question, answer it. If you completely don't know it, completely guess, or you're going to have some uncertainty. The majority of questions, just kind of think it through, take a deep breath, and then go with what you truly believe. Don't try to second guess yourself. Usually your gut reaction is going to be initial. If you're not sure, you're not completely trusting your gut reaction, read the question again just to make sure that you didn't misread it or whatever, misinterpret it. Again, there are these 8 sections. Now, the ABPN, this is a hard exam. First of all, it's very long. It's physically, mentally, emotionally draining. So it's hard because, as you know from this course, we're covering so much material. And it's also hard in terms of the pass rate is rather low. Pass rate of, in 2022 was 79 and 2021 is 82. The people, those of you here taking the course, our pass rate has been like 94, like pretty steady over many years. And as I like to point out, a high percentage of everyone taking the Psychiatry Certification Exam is actually a participant of the Beat the Boards course. So if the average ABPN is, around 80, our average at the course is 94, that means the people not taking the course, their average is below 80. It stands to reason. So again, there's no guarantee, and you're just going to have to kind of, in a way, recognize that you're living with some degree of uncertainty. Uncertainty whether you're going to pass or fail, but be true to yourself. I'd rather fail having answered the questions in the way I believe I was choosing the correct answer, rather than kind of second guessing myself, like, oh, what were they thinking? What are they testing me about? And then just tying myself up in knots. Now here, this is a bunch of screenshots. This is right from the ABPN. It's on their website. You're welcome to look it up. But just, and I would encourage you to do that so that you feel comfortable that when you're taking the real exam, it's like, okay, I recognize this. It's familiar to me. And you see, you can, the screen shows you the total amount remaining. And for some people, it's frustrating that they don't give you like a time, remaining in each section. But that's not how it works. You got a total of 500 minutes. No one cares how you divide it up, whether you take 60-minute breaks, 120-minute breaks and cut into your exam time, whether, you are, do 4 straight and then save break times for later. So it's just sort of the only way they really can do this. And I've had people tell me it's frustrating because it's like, it's hard to kind of gauge, but what does it mean I have 5 hours left or 3 hours and 48 minutes? So ahead of time, just divide, the 500 minutes into 8 sections, and then you'll figure out how much per section. Now, keep in mind that some people are faster on the standalone sections than on the linked vignette sections, and that's also something you can kind of start learning about yourself. Also, it shows you the progress, like how many questions you've done. and also that you can flag things for review and kind of that you can navigate. You can also highlight things, so there are these kind of ways of, in a way, helping yourself keep track of what you're doing. So you can kind of highlight response options. For example, like one way you can do it is like highlight the ones you know are wrong in red. Now you could do this in your head, but sometimes you're like, okay, I'm getting tired, let me just kind of, in a way, in this very clearly visual way, mark them red that I know that those are definitely wrong. And if I'm not sure, I'll just choose from the among the remaining ones. You can strike through things. There's a scratch pad you can use. So a lot of helpful things. Don't feel like you need to use any of that. You know, I like to keep, for me, I like to keep it simple and just kind of plow through it as fast as I can without rushing. I don't rush, but I go quickly. But again, I'm not saying that's right. I'm saying that each of us has a better and worse way for ourselves. I try to finish the exam in half the time. You may say, like, well, that's crazy. I'm going to take all the time they give me. And that's fine. That's perfect. You know, all it matters is that you pass. You can go fast, you can go slow, you can be happy, you can be sad, you could be tired, you can have a headache, you can have the flu. All you have to do is get enough questions right. That's the only metric. So these are the 8 sections, and you notice that in the certification exam, they alternate between the standalone and the linked item set sections. And you'll also notice in the second column that the number of questions is not equal between the sections. The ones with the standalone questions, those sections have actually more questions, 68 as opposed to 38 for the linked vignette ones. So a very common question is, well, what do I study? Well, you know, you've probably already heard me say this at this course, you know, I follow the Doc Sutton rule. Doc Sutton, the bank robber, was asked, why do you rob banks? He said, that's where the money is. So for us, for the exam, we want to concentrate on the topics that, you know, have the highest percentage of questions, the highest total number of questions. And so there are the big 8 topics that account for 60% of all the exam questions. And they are substance-related and addictive disorder, schizophrenia spectrum, depressive disorder, bipolar disorders, anxiety disorders, trauma and stressor-related disorders, personality disorders, and neurocognitive disorders. And you notice those percentages on the high end are like 8 to 12%. So that means like on different exams, you know, they can vary the percentages of, let's say, substance-related questions. Sometimes they're a little more, sometimes fewer. But anyway, so on the high end, it's 8 to 12%, and on the lower end, it's 5 to 7% of these big 8. And everything, and then look at the rest of that page. Everything below that is quite low. You know, eating disorders, complex topic, on average is only going to be 3% of questions. You know, I really like sleep-wake disorders. It's a very complicated topic. It's only on average going to be 4%. And then you notice a lot of the other things, like paraphilic disorders. It's like between 1 and 2%. And then also in red, I have neurologic disorders. So again, on your exam, and for a certification exam, this is a huge decrease in the number of neurology disorder questions. Back in the day, can't tell you when, maybe before the year 2000, was like 36%, and then it went down to like 24%, and then just recently, I can't remember, 2019 or something, it really went down to this low percent. And that leaves you a conundrum, because neurology, that's as big of a topic as a psychiatry, and yet it's 5% of the exam. And so you kind of think like, you know, I don't want to ignore it completely, but on the other hand, it's, you know, given the entire topic of neurology, that's pretty low yield. So that's why we've kind of have this kind of balanced approach, and that's why Dr. McCoy comes in, tries to give you really the highlights, and that's the way I would think about it. Spend some time on neurology. Again, what we have in the course, there are neurology questions in the Q bank. Just to point out, when it's neurologic disorders, that's above and beyond the neurocognitive disorders, which are the dementias and delirium. That's kind of, again, that's a separate topic, right? 21, the neurocognitive disorders. So that is in addition to the neurologic disorders. Now, the other question is, okay, so most of these topics, and this is called Dimension 1, are disorders. They're focused on disorders. And it's like, well, what part of the disorder are you testing me on? And here's now the breakdown of what we focus on. And there are 3 lines highlighted, and let's start with the bottom one. So the biggest percentage of all the questions about depressive disorder, schizophrenia, opioid use disorder, dissociative identity disorder, whatever it is, it's going to be on treatment. And that makes perfect sense. So what categories of treatment are there? Well, there are medications. How do we use them? What do we use them for? Indications, adverse effects, especially serious or common ones. Drug-drug interactions are a big topic. Now, in addition, though, to just kind of individual medications, it's also you take the point of view of the disorder, like what is first-line treatment? What is second-line treatment, third-line treatment? So you hear me always stressing that. These are the first-line treatments. These are second or third-line treatments. These are augmenting strategies if you got partial response. So you need to know that. Also includes neuromodulation and, of course, the psychotherapies and other psychosocial things, interventions. And then the next line above that's highlighted, clinical aspects of psychiatric and neuropsychiatric disorders. What does that mean? Well, that's really about like diagnostic criteria, recognizing the diagnosis, what are the kind of features, and does it, who does it strike? Is it a young person's disease, an old person's disease? Things like that, demographic features too. And then the top highlighted line is neuroscience and mechanisms of disease. Again, we cover that in the course. It doesn't go very deep, but that is a substantial, number of questions on, what is in ADHD. You can see, kind of on average smaller brain volumes. In schizophrenia, there's going to be, relative ventriculomegaly, larger ventricles, lateral ventricles, and things like that. Things about neurotransmitters and brain localization, things like that. So now another area is, the DSM-5 TR came out not long ago, and the examinations administered in the year of 2023 still continue to use DSM-5 and not the new TR version. For your exam, the certification exam, the DSM-5 TR will begin in 2024. And then, not of great interest, but for the continuous certification exam, the TR only kicks in the year after that in 25. So again, as I mentioned, there are 2 different exam section formats. 4 that are these standalone questions and 4 are these linked set vignette questions. The standalone questions account for about 2/3 of the exam, and the linked item set for the remainder. The standalone questions are written as single best answer questions, single best answer. The questions are all independent of each other. They are, now just because they're standalone doesn't mean they're fact-based. Even in this section, you can have like little vignettes. You've seen me in my lectures present questions like, someone presents with cognitive impairment, and I'm leading you to believe that it's NCD with Lewy bodies, right? That's the right answer. That's a standalone question, but it's not written as like, what is the most common cause of intellectual disability? That's a fact-based question. There's also these vignette kind of questions that, are obviously longer. The linked item set vignette sections, they show you video or audio, 1 to 5 minutes in length. Headphones are provided because you're not going to be playing it when there are other people in the room. And also some of these vignettes are in the written form. These are not single best answer format. Some of the questions do say choose one, but they tell you choose one, choose two, choose three. You cannot advance to the next question until you choose the right number that they tell you to choose. So if it says choose two and you're three, and you choose two, it's not going to allow you to advance. Now, then the question is, well, what if I get, the 2 out of the 3 right? No, there's only you either get the question correct or you get it incorrect. You got to get, if it tells you to choose 3, all 3 have to be correct. Now, this is also, I want to just highlight, this is separate from the fact that these are the linked item set vignettes. So there might be like 2 or 10 questions linked to that single vignette. So, but the questions are linked to a case, but each question is independently scored as being correct or incorrect. So within the question, if it tells you to choose 3, you have to choose all 3 correct to get that answer right. But you can get that answer right and another one wrong in that linked set, that linked item set. Possibility of reviewing questions. You can review questions, but only in the standalone sections, not in the linked set review, because subsequent questions may provide the answers to previous questions. So if you were able to go back, you'd be like, oh yeah, oh no, I got this wrong, because the subsequent question kind of either gave you a hint or just baldly said, this is what's going on. So you cannot return to them. So those questions cannot be flagged for review and they cannot be returned to. While in the standalone, they can be flagged for review and then could be returned to. And that's true, by the way, the flagging and whether they're answered or not are separate. You can flag questions that you did not answer. You can flag questions you did answer but want to return to in any case. And then again, here's like a screen capture I did, just kind of showing you that you can always go to like a review page that will show you all of those questions in that section to make sure you didn't like leave something incomplete.